You can go off camera if you wanted to.
Good evening, everyone. My name is Tracey Curtis, and I am your host for this Finding Your COVID Balance seminar. And I'm just going to start with a land acknowledgement for this evening. So recognizing the continued and ongoing effects of colonialism in the area, Ontario and Canada, and as people living and working in Wellington and Waterloo region, we'd like to acknowledge and honor that Guelph is situated on the ancestral homelands of the Anishinaabe peoples, specifically the traditional territories of the Mississaugas of the Credit First Nations. This land that is steeped in rich Indigenous history and has been home to a variety of peoples over the millennia, today, and this area has become home to many First Nations and Métis and Inuit people. As a community, we have the responsibility for the stewardship of this land that we live and that we work. Today, we acknowledge the historic Mississaugas of the Credit, the First Nations people that were the treaty signatories of the territory to which we are meeting. Today and every day, with gratitude, we acknowledge that the settler population that has been able to benefit from this beautiful land. As citizens, we have the responsibility of the stewardship of this land, acknowledging the land and the people whose land on which is a small part of this process of decolonization. So we started this amazing webinar June of 2020, initially as a fundraiser for Bracelet of Hope. And it has just grown into a wonderful wealth of information for people. And it's just been incredible to sit back and watch, and we are so grateful to have you all join us today. I would like to introduce you first to the one and only Marva Wisdom. Marva is a wonderful community leader and an advocate for many people. And Marva has been our moderator right from the day one. I remember when we started coming up with this idea, I thought, who should moderate? And it was the only person was Marva Wisdom, because she's just wonderful. So thank you, Marva. You're going to introduce our guests. So I'll pass the baton over to you. And thank you all for joining us this evening.
I just realized that I may have had my mute on, which I tend to do sometimes. So folks will help me say, Marva, your mute is on. Thank you so much, Tracey. Thank you for asking me to do this. As you said, some time ago, back in June, it has been wonderful for all of us here to serve the community in this way. Good evening, everyone. Thank you for joining in the conversation, whether for the first time or returning. My day job includes directing the Arts Everywhere Festival. And as Tracey said, I work to support groups and organizations, certainly in the areas of equity, inclusion, and working toward eliminating systemic racism. While COVID-19 has laid bare the inequities in our society, it also has helped to surface our empathy and understanding of our common humanity. The latter is a driver of why we bring you this monthly webinar and why we're glad to do so. Each month, Anne-Marie and Helen engage with local experts about finding the physical and mental health balance during the COVID-19 pandemic. And let me just say a few words about Anne-Marie and Helen, but also about our special guests. Anne-Marie Zadjlik is a primary care physician in Guelph, providing comfort and guidance to thousands during the pandemic. Anne-Marie's become a Facebook sensation with her daily posts of encouragement and sound scientific knowledge about COVID-19 and other health issues. Helen Fishburn is the CEO of the Canadian Mental Health Association of Waterloo, Wellington. She's a lifelong advocate for increased awareness of mental health issues, and she's dedicated her career to advancing the design of an improved mental health care system. And also joining us tonight is Dr. Matthew Tenenbaum, the Associated Medical Officer of Health of the Wellington, Dufferin, Guelph Public Health Unit. And Dr. Tenenbaum was a physician consultant at the Wellington, Dufferin, Guelph Public Health prior to his appointment as Associate Medical Officer of Health. For several years, he was a family physician in Hamilton upon completing his residency in public health and preventative medicine at McMaster University. He worked in several public health units before joining us here in Guelph. We're so delighted to have him here this evening. Dr. Tenenbaum and Dr. Mercer, who's our Chief Medical Officer of Health, and the WDGPH team have been stellar in their dedication and leadership throughout this pandemic. We appreciate that he has carved out some time in a very busy schedule to be here. And so we're turning it over tonight to our panelists, Anne-Marie, Helen, and Matthew. We are really pleased to have them here tonight. Let me go over very briefly a few housekeeping items before they share their opening remarks. Tonight, you may be joining us either on the Zoom webinar link or via our Facebook Live broadcast. We are ready to receive the questions for either platform. So we're asking you to please feel free to type your questions into the Q&A section of either Zoom or Facebook, and we will do our best to answer as many questions as possible. I know that Dr. Zadjlik, sometimes she just go off the Q&A section of the panel, and then she goes in and she answers some of those questions. So we really appreciate it. And that gives us an opportunity to answer as many questions as possible. We are recording this webinar, and it will be posted on the CMHA Waterloo Wellington webpage. And it will also be posted on Dr. Zadjlik's Facebook pages after the webinar is over. So with that, you would like to hear from Helen, Anne-Marie, and Matthew. And I'll ask Helen for some opening remarks, please.
Thank you, Marva. Welcome back, everyone, to another webinar. Who knew that after 20 months, we would still need to be coming together monthly to focus on finding our balance in this global pandemic. But we have made amazing progress in our physical fight against COVID and the nasty Delta variant. We've seen our COVID numbers stabilize locally while watching our community vaccination rates rise. That trend will only be reinforced when we start protecting our most vulnerable children and with their own version of the vaccine this week. So life is gradually returning to normal, but we also know that there are lingering mental health effects from the last 20 months that just don't disappear because we can go out to a restaurant again and have dinner. There's a cumulative impact of the stress, the worry, the grief, the loss that almost all of us have experienced in one form or another. And as we prepare for another holiday season, which is just around the corner, it's important for us to be honest with ourselves about what we're carrying and how heavy that load is. So we're going to unpack some of that tonight and do our very best to help you lighten that load.
Thank you, Helen. Anne-Marie?
Oh, sorry, I'm at it again. So I just wanted to comment on a couple of things because I think we're going to do a lot of talking tonight about kids vaccines, which the kids will start being vaccinated this week, I believe, or next week, November 29th, I think, in Guelph, and in Toronto, the first kids vaccines were given today, first in the country. So we'll try to answer as many questions as we can that you might have about kids. I think it's important for people to understand that there's many reasons to vaccinate kids, even though COVID-19, the risk of dying from COVID-19 in kids is less than 1%. There are many other reasons to vaccinate. Example today is that we had 600 plus cases in the province of Ontario, but a full third of those typically are in kids, which means kids are starting to spread the virus amongst one another, and there's also community spread. And without vaccinating kids, we really won't get COVID-19 under any significant control. So I'm going to be a cheerleader for vaccines in kids, and I'll pass it on to Matt. Is that okay, Marva, to pass it on to
Oh,
Matt?
absolutely.
Okay,
Yes.
go for it, Matt.
Great.
Thank you, Marva, Anne-Marie, and Helen. So I appreciate being here with you this evening. And I think building off of what Anne-Marie was talking about, obviously this week is a very special week, certainly for myself and for many of us who are thinking about the needs of our 5 to 11-year-old population. It's great that we now have this vaccine approved. We now are going to have it available to begin giving in arms as early as this week. And we have providers in our community stepping out to deliver those doses this week. Thinking about the fact that we are here now is making me think a lot about where we've come from and where we're going to be going. Obviously, we've had a lot that we've gone through as a community over the course of the past nearly 2 years. And one of the things we have seen is the dramatic impact that vaccines have made in terms of reducing risk of COVID, becoming sick, reducing risk of having any complications, going to hospital, dying of COVID, limiting outbreaks and all of that. And it's been a real shame that until now, we haven't had the ability to give a vaccine option to children under age 12. It's great that we're going to begin to have that option because we know that children in our community have been experiencing COVID. And we don't often talk about some of the ways they're experiencing the pandemic, but they have borne a lot of the brunt of both the infection itself, but also the measures. Anne-Marie spoke about the cases and how we're seeing more cases proportionally among people in the younger age groups because they are not vaccinated. But we also know children are affected by outbreaks that happen, for example, in their school when they're sent home and they can't participate in in-person learning. They're affected by the measures, the inability to see their friends, participate in the normal social activities. These things are affecting their learning and development, and their ability to thrive is bound up with all of our abilities to thrive in our community. And the sooner all of us can get out of this pandemic state, the sooner all of us can get back to a better context for developing and thriving. We know that in the same way that getting adults immunized has gotten us to where we are now, getting kids immunized is the next big step to help move us from where we are now to our post-pandemic future. So we're really excited and hoping to answer some questions that you have tonight about the vaccine.
Thank you, Matthew. It's great that you're joining us tonight. We really appreciate it. So are we ready to get into the questions and the discussions? I'm going to be starting off with a question. I'm going to select one having to do with children getting vaccinated. That is one of the key areas. And then I'm going to ask a few questions that have come in around booster shots. So the vaccines for children are so new. How do we ease our child's and our own anxiety about the vaccination? The person says that my daughter is starting puberty. How do we know that there will be absolutely no issues for her in the long term, i.e. fertility, cancer, etc.? Is there any concern regarding vaccines and prepubescent children, i.e. tweens? The person goes on to say, I understand there may be no current cases, perhaps, but do we have longitudinal studies, or are we taking a scientific guess? We're making a decision for a child and we don't want to jeopardize her long-term health or have regrets. And so the person goes on to say that this response will be helpful for us to make our final decision. And we truly appreciate your medical feedback. And she said, we would love to ask our family physician, but she's still not seeing patients in person. So Matthew, I figured that you first time on, this might be a great question for you. How's that?
That sounds great, Marva, and I appreciate the question. I think this is one of the most important questions we're going to get asked and answer this evening. I know that with the vaccines just having been approved, people have questions. People want to know that they can be confident that getting the vaccine is the right choice for their child, their family, and their community. And I want to make sure we're able to speak to some of the concerns that might exist among people who have questions about the vaccine. Even though this is a new vaccine, I want to talk a little bit about the process that Health Canada goes through when they review a vaccine application. So they have the manufacturer conduct a number of different trials. They have, study populations where people get the vaccine or they get a placebo, which is essentially a fake vaccine. And then they compare side by side the results from people who got the vaccine versus didn't, and see if it has an impact. We know from those studies, not just that the vaccine is very effective, but that the vaccine seems to be very safe. People who had side effects typically just had a sore arm. They did not see things in those studies that are of concern to us. And we know that Health Canada would only authorize and approve and recommend these vaccines if they were also convinced that the benefits of getting immunized outweighed any potential risks for each individual person getting the vaccine. It's incredibly important that we hold these vaccines to a very high standard when it comes to safety. And vaccines do not get approved in Canada if we have concerns that it's not the right option and it is not a scenario where the benefits outweigh any potential risks. So we're really happy that Health Canada has gone through that process. We know we can have confidence in that process because that's the same process that all vaccines and all these different pharmaceutical and medical products go through. And even though we have all this understanding now, we're also not going to stop learning about the vaccines. We know that as vaccines roll out, we're going to continue to look for any possible reasons to be concerned. We have a really strong vaccine safety system where any concerns about vaccines get reported to us in public health. They get collated. We look for any reasons we might need to be worried because we don't want to take anything for granted. We want to make sure we keep our eyes and ears open. So we have a very strong vaccine safety system in Ontario that we'll continue to use with a child vaccine as we did for the adult vaccine. Fortunately, we saw with the adult vaccine, that's very effective, it's very safe, and we are fully expecting that the child vaccine will behave the same kind of way.
Thank you very much, Matthew. Thank you. The next question is related, and I'll ask Anne-Marie to chime in here. The question from Karen says that my child is only 11, but is already in puberty and is built more like a 13 to 14-year-old. Is the pediatric dose of 1/3 the adult dose based on age or weight? Will there be a protocol for children who are larger than the average at their age? And the person says that I'm concerned that the pediatric dose won't be effective.
So in fact, the pediatric dose is very effective even in children who have adult bodies. So that might be your 12-year-old. And they only need 1/3 of the dose. It is really effective in kids. They're mounting a very good immune response. And the third dose, the dose that is 1/3 for kids, seems to be causing fewer adverse events and side effects. So very powerful, even if your kid is fully grown, if your child is fully grown, and far fewer adverse events. No serious side effects whatsoever, serious adverse events, no myocarditis, that's important, no myocarditis, and that's 3 million kids that have been vaccinated in the States, no safety signals. And what that means to people, smart people like Matthew, is no signals to suggest that there is a very serious adverse event that is life-threatening. These are really, really safe and powerful vaccines in children, and it's quite amazing scientifically that that they're around for our kids.
Great, thank you both so much. Helen, people are very sick of not gathering. How do we weigh the mental health benefits versus physical health when it comes to holiday gatherings? How should we navigate the Christmas holidays from a public health and mental health perspective? I think all three of you can weigh in here. Helen, if you could lead off the response, that would be wonderful.
Sure. So, I mean, this is a really important question because, again, as I referenced in my introductory comments, even though we've made great progress and we're so much farther ahead than we were last Christmas, we still can't have a regular Christmas in the way that many people would like. So we do need to continue to follow public health guidelines, which is really, really important. And I think, and again, a good part of this is mental. We need to kind of prepare ourselves that this isn't going to be a regular Christmas, and that's okay. There are things that we can do this year. Still gather indoors with 25 people, still make sure that people are vaccinated, follow some of the public health guidelines. There are still many ways that we can come together to celebrate, but it may not be exactly the same as what we would like or what we're used to. I think there are also, so some of that will require a mental shift, Marva, for people to go into the holidays with those expectations, but also enter the holidays with an air of gratitude, right? We know that gratitude is such a huge part of hanging on to that hope. And again, appreciating how far we've come in a year. A year ago, none of us were vaccinated. And here we are now, a year later, we have a 86, 87% community vaccination rate, and we're just on the cusp of vaccinating our young children. That is remarkable. We're very fortunate to live in this country where the standards are high and we are really protecting our population. So if you enter into the holidays with that kind of gratitude in that perspective, welcome the rituals and traditions that are often part of holidays, where we all get to embrace it. Some of our baking, some of the decorating, some of the inviting people in, seeing people outside. Again, there are many, many ways to maintain our safety while still embracing those holiday moments. And that is really the balance that we're all going to need to strike this holiday season.
Thank you, Helen. There are so many questions around holiday gathering and so much excitement, but also there is the fear there as well. Matthew and Anne-Marie, did you want to chime in on this?
I think I'll echo a lot of what Helen was saying and just emphasize that we know from a public health perspective and a mental health perspective, seeing people over the holidays is really important. We need those person-to-person connections. COVID has disrupted so many of those, and we need to find ways to connect if we're going to get through the next phase of this until we get to the finish line ahead. So we need to be able to find ways to be with people we care about and who are meaningful to us and engage with them in really meaningful ways, but we can do that safely. And if we are gathering indoors, it's really important that everyone who can be vaccinated is vaccinated. Certainly, if anyone's feeling unwell, we don't want them meeting with others and gathering with others because that could be a symptom of COVID. We wouldn't want that to spread. And of course, you don't want to keep gatherings too big. We want them to stay reasonably small so that we're able to kind of contain people into cohorts and limit any possible transmission events. We have some pretty simple principles we go by, but one thing we have this year that we did not have last year is the ability to get people vaccinated. And if everyone who's at these gatherings who's able to get vaccinated is fully vaccinated, meaning 2 doses plus 2 weeks, that's going to dramatically reduce the risk of COVID, and it's going to mean that you can gather more comfortably and more safely.
And as you speak about being double dose, let's get into the 3rd dose, which is a booster shot. Carrie asked, are doctors' referrals still needed to get the booster shot? She says that I was able to get my annual flu shot early as public health defined me as high medical risk. However, I cannot get my COVID vaccine booster as public health does not seem to define me as high medical risk for that, despite government public health websites defining me as being high medical risk in 2 categories. It has been 6 months since my 2nd shot. I'm 58, and even though my medical conditions are not defined as autoimmune, I never get any illness mildly. So she's saying that she gets seriously ill. Will I have to wait until the general population is allowed boosters despite my medical risks?
That's a really good question. We know there's going to be a lot more activity on the booster front in the coming months ahead. And really that's because we are going to take an approach that follows the science. Over the course of the pandemic, we've been asking the question as a scientific and public health community of, what is the impact of 1 dose? What is the impact of 2 doses? And then how long does that benefit of 2 doses last? And one of the things that we are learning is that for people who, for example, live in long-term care homes, people who are in the oldest age groups, or people who have high risk of exposure like healthcare workers, there is actually a good scientific reason right now to offer them a booster dose of vaccine. That science is going to be evolving, and you may see new recommendations coming up down the road about eligibility for a 3rd booster dose based upon that science. But we do want to follow the science. We do want to make sure we're offering it when it makes sense to offer it. And to, once the science shows it is worth doing, move swiftly to offer that vaccine dose. We follow the science on that front.
Mm-hmm. Thank you for that. Teresa says that her daughter is turning 12 the end of January 2022. If a vaccine is available to her prior to her birthday, what dose should she have? And I think we sort of answered that part of it. The other part that she has is that about her birthday date, if there's a 2-month wait between the rounds, she will be 12 for her 2nd shot if her 1st shot is available the end of this week. She's just wondering what is recommended. Also, if there is time, She's heard 2 recommendations regarding the flu shot. She's heard that when she is eligible, her daughter, she could get them at the same time, but then heard another view that she should spread them apart. What is the recommended method? And I would suggest that many people are trying to figure out, especially at this time of year, whether you can get the vaccine and the flu shot at the same time. Not just for a 12-year-old, if you could respond to that, but also for the regular population. I'm gonna let Anne-Marie and Matthew tussle over that one.
So I'll answer the flu shot one, and then I'll go back to the Q&A. You can get the flu shot at the same time as you get the COVID vaccine. You may not want to overwhelm your child's immune system, although children are handling the vaccine so well, but it is okay to have the COVID vaccine on the same day, which means there doesn't need to be a time interval between the COVID vaccine and the flu shot.
And if I can just build on that as well. So we know that, you know, getting the flu shot, getting the COVID vaccine, getting any other vaccine someone's eligible for is really important. It's not just COVID that we think about that can cause illness, that can cause hospitalizations. There are other diseases out there that we want to protect against. And so it is important for people to get both their flu shot and their COVID vaccine. As Anne-Marie said, you can get both of them together. There is no reason to worry that if you get both of them together, they're going to be less effective or that there's going to be any safety risk. What some people may have heard, though, is that there is some benefit to spacing them out because that's been recommended, for example, from our National Advisory Committee on Immunization. The reason they made that recommendation is actually to help us in public health. When we offer vaccines, we do a really, really good job of tracking. If someone has side effects and they tell us, we investigate to find out whether we think that side effect was linked to the vaccine at all. So for example, if someone gets a sore arm that lasts for 4 days or more, or if they get, you know, muscle aches, or they get other symptoms that they think are linked to the vaccine, they tell us and we investigate. And what can happen sometimes is that if someone gets multiple vaccines together, it's more difficult for us to figure out which vaccine may have caused that side effect if either of them did. So that is not to say that you can't get the vaccines together, because you can and they are safe and effective. It's just easier for us if people get them spaced apart, but we know getting both vaccines is really important. So you want to encourage people to go ahead, get the flu shot and get the COVID shot when you can. To the other question about people who are currently 11, turning 12, what's the plan for them? That's something we've been thinking about and planning for, because we know there's going to be a lot of people who in that 8-week interval change ages between 11 and 12. What we're recommending right now is that when you get that first dose, if you're 11 years old, you get the vaccine at the lower dose, which is recommended for 11-year-olds. If in that time between first and second dose, you become 12, then as a 12-year-old, when your second dose comes up, the best vaccine for you to get is the vaccine approved for 12 and up. However, every client or every family in that scenario who has that situation will always have the option also of getting the lower dose vaccine to get that second dose if they want to get the same vaccine for both doses. We see that being an important choice for families to make, and so we want to make sure they have that choice.
Thank you. And as parents are becoming more anxious, this question is for Helen. How do parents handle the anxiety of vaccinating their children? We know that there are many people as adults that are anxious about getting vaccinated, and now the children. What are some of the strategies that they can use, Helen?
Great question, Marva. And maybe I'll start with the kids in terms of how to manage with an anxious child, and then we can move to the parents as well. So first of all, this is really typical. 2 out of 3 children have fear of needles. And for many of these children, they'll fear, the fear actually gets worse as they get older. And actually 1 out of 10 adults also has a fear of needles. And that does definitely impact people's willingness to get the vaccine. So it's a real concern. So relating to children, definitely we want to prepare your child as much as possible for the vaccine. Make a plan. They need to know what to expect, you know, what it looks like, walk through the process, and also help them prepare and give them some sense of control in that, right? You can ask them questions like, what's going to give you some comfort during this experience? Do they want to bring their stuffed animal, their blanket? Do they want to hold their parent's hand? What kind of treat would they like to have? after the injection, kind of walk them through that with a whole plan. We also really need to be honest with kids so that they know what is to realistically expect. And then also communicate to them that we think that they can totally handle that they're ready for it, that they're brave, that you're going to be right there by their side. So give them that sense of confidence. You can certainly apply a numbing agent to your child's arm before the shot. And there's some over-the-counter stuff that you can get at the drugstore, which again could be quite helpful. And certainly we want to communicate that it's okay for your child to be anxious. A lot of people are anxious about getting a vaccine or an injection of any kind. And again, we want to communicate that we think they can then manage that very well. It's so important also to communicate the why to your child, why they're getting this vaccine, and that superhuman protection that we can communicate to a child, again, with age-appropriate language. So in terms of parents, it really is important for parents to stay calm and to stay grounded. It's always hard as a parent. And I remember when my my two kids were vaccinated when they were little as well. Your heart goes out to the child because you can see that fear on their face, and they're bracing themselves for what they think is going to be extremely painful. Usually in their mind, it's a lot worse than actually what they experience. But as a parent, you never like to see your child in pain, even if it's just for a minute. So remember, as a parent, it's always about protecting your child. Even though that one small poke might hurt, it is so worth the protection it will provide from this nasty illness. Also share your worry with someone else other than your child. So whether it's someone else in your household or your best friend, just talk to someone else and just try and get some of that worry off your chest. And practice some self-talk for yourself. And some mindfulness when you're actually in that vaccination appointment, so that you can stay grounded, and then you can put that brave face on for your child. They'll be looking to you to take those cues. So together you really enter into that appointment knowing that it's the best thing for your child. It's going to be a very small, minor discomfort. You and your child are in it together, and it's something for both of you to feel really good about once you've had that shot.
Thanks, Helen. I think parents are out there feeling really prepared now, ready to go. Matthew, at Public Health, what are some of the approaches for these young kids? How are you preparing at Public Health for vaccinating these young people?
We've been doing some preparations for some time. We knew that as soon as adults and teenagers were able to get vaccines, the older children were going to be the next big group. So we began having conversations some time ago with primary care providers in our community, with pharmacies, with other partners who are able to deliver vaccines and who helped us with that effort with the adults in the past 6 to 8 months. So we've been doing planning for some time, and people should know that they can access vaccine in a number of different places in our community over the coming weeks. The most important of which is people who have a family doctor or a primary care provider should come to them first. We have primary care providers in our community who are stepping up, who are offering vaccine to their patients. And we know that oftentimes a primary care provider, a family doctor, a nurse practitioner is someone who has a relationship with that child or that family, and who's able to really speak about the questions and concerns they have, provide good information that's trusted, and be really credible. And we know that people in that younger age group want to have a familiar face where possible giving the vaccine. And so it often is best if they have a relationship that already exists with that healthcare provider who they have been seeing for other issues over the course of their life. We're also going to be delivering vaccines through pharmacies in our community. We're going to have public health-led clinics as well. There's going to be a number of different ways people can access vaccine. We do want to make it easy to access. And we're fortunate that we are going to have supply coming in to offer vaccines broadly to this age group.
Great, thank you. And Teresa says, I understand that Wellington, Dufferin, Guelph Health Unit will be administering vaccines for all kids born in 2016. How will this work for kids born in 2017? So someone turning 5 next year. Do those kids have to wait until their birthday and have actually turned 5? Or are they eligible as of January 2022?
It's a great question. And it's one that we have gotten. And we know that, for example, when we were offering vaccines to 12 and up, the province decided that it was going to offer it to everyone born in 2009. That entire cohort of people became eligible. Now that we've expanded to down to age 5, we're saying everyone turning 5 this year is eligible all at once. So if you're born in 2016. When it comes to 2017, we are working with the province to understand what their recommended approach is going to be and who's eligible once January hits. We expect to have an answer well before January hits. Certainly, if you have someone in your family who's born January 1st, January 2nd, no problem. They're going to get that vaccine once they turn 5. In terms of people who are born later in the year, we will have more of an update for you coming pretty soon.
So for those who are, there are a number of questions here about under 5. So for under 5, it's a matter of waiting then?
So right now, if your child is 4 years old, turning 5, between now and the end of December, this calendar year, they can get immunized as soon as vaccines available for them. People who are turning 5 next year can get the vaccine once they turn 5. The question of whether we can immunize them while they're still 4, if they're born next year, that's the one that we need to wait for an answer on from the province.
Right. Okay. Thank you for that. Thank you. Anne-Marie, someone says that I'm wondering how the epidemiologist, yes, determined that it is safe for 25 people to gather indoors. This person said there's 27 in our family and we haven't been together for 20 months. My answer would be put the mask on, gather safely and carefully, but I'm not the doctor or the mental health person. So I'm just gonna turn it over to you guys to answer that.
Yes. So I think the number 25 is determined by the risk of transmission and the R value of the virus. I'll let Matt talk more about the epidemiology, but the Delta variant is very infectious, and I'm even concerned about 25 gathering inside. I'd hate to say that. Fully vaccinated, wearing masks, there's still some transmission. And unless you've got a fairly large space and you can have some windows open, I'd still be concerned about transmission. I was at an event on the weekend that had 25 people, and I stayed off to one side. I didn't sort of mix and mingle with the larger group. COVID's very transmissible. I think we need to be very careful this Christmas not to jump too far ahead of where we are with respect to community transmission.
Can I add something to that before Matt jumped in? I was at an event also, and I got really scared because there were drinks being, people were having drinks. And so people took their masks off. They have their drink in their hands and they have their mask off and they're drinking, and they're not putting their masks back on in between. So, and I was just sitting there going, oh my gosh, I'm not even gonna have a drink. I'm gonna keep my mask on the whole time. And I was quite concerned about how safe that was. So perhaps, with all of those factors, it's important, an important consideration that you may not always be able to be safe. Matthew, that's my unscientific example.
I mean, just kind of beginning on a general principle, if you think about the bigger a group you gather in, the higher the chance is that someone in that group is going to have COVID. And if someone has COVID, the more people they can spread it to. I mean, those are both kind of intuitive facts that we can work from. And of course, we know that the risk of spreading COVID indoors for a whole host of reasons is much, much higher than the risk of spreading it outdoors, which is why we have separate and different capacity limits for indoor spaces versus outdoor spaces, different gathering limits. Now, there's nothing magical about 25 versus 24 or 26, 23, or 27. There's nothing magical about that exact number. But what some of the epidemiologists can do is they can actually do some modeling, and they can make assumptions about if people gather in these kinds of ways across a population level, and we have X number of cases, X case rates, what could we see in terms of transmission dynamics? And those modeling results inform the policymakers and decision makers to make those rules about gathering and capacity limits. So there's something magical about that exact number, but this is a scenario where more is more. And of course, more gathering, more risk of someone having COVID, and more potential chance for spread within that gathering group.
There's a really good website that I can share on my Facebook page that actually shows that modeling and tells you, okay, if 25 are gathered, what's the risk of COVID-19 being spread? If 50 are gathered, if 100 are gathered. And it's really alarming to see how many more folks are at risk for getting COVID-19, the larger the number of people that are gathered.
I think the other piece to add from a mental health perspective is, even though, you know, people really need the mental wellness relating to Christmas gatherings, if you push the limits around those numbers, in, as Matt and Anne-Marie have both said, the risk goes up. God forbid somebody does contract COVID, you know, you would feel horrible after the holidays, right? So even though it might feel lovely in the moment, pushing those limits and breaking some of those guidelines, and then having the unintended consequence of somebody contracting the illness, it just wrecks all of that goodness. So lowering the risk and enjoying what you can safely, without having to worry about those consequences after the fact, is actually better for your mental health in the long run.
Thank you, Helen. Yes, that worry, that worry is important. Someone said, I read that obesity can compromise the immune system. Are obese people able to get boosters now? And in addition to that question, is there an anticipation as to when folks under 70 years old can get booster shots?
I can speak to that one, Marva. That's a really good question. And the short answer is that there are a lot of medical conditions people can have, a lot of common conditions like obesity that do impact your immune system. The immune system is, it responds to a lot of different factors, you know, your environment, your other medical history, all those things influence your immune system. But there's different kinds of immune system impacts that different diseases, different conditions can have. We know that, for example, obesity can impact your immune system, and the more obese you are, the more it can impact your immune system. And that exists on one end of a spectrum. On the other end of a spectrum, you have some people who are really, really, really severely immune compromised, people who have certain kinds of blood cancers, who've had organ transplants, or certain kinds of really powerful medications that really disrupt their ability to mount an immune response. They are what we're considering the severely immune compromised population, not a huge group, but a really important group. One of the things that we've learned about the vaccines is that for almost everyone in our community, if you get 2 doses, you have incredibly strong protection against COVID. Booster or not, 2 doses gives you really, really good protection for almost everyone. However, we have been learning from some of the emerging science that people who have these severely immune compromising conditions, for them, 2 doses actually isn't enough. And they actually need 3 doses to get to where most of us are in terms of protection with 2 doses. They need an extra dose just to get to where we are as a 2-dose population. And so we have been offering 3rd doses to those people who have certain criteria they meet in order to get them to that baseline level of protection. For them, it is not a booster. For them, it is getting them to being fully immunized, because before that 3rd dose, they are not fully protected the way they should be.
Thank you. And a follow-up question, does everyone need to wait 6 months post 2nd shot for the booster? This person is asking for their 90-year-old mother.
So the short answer is yes. Right now, our recommendation is that people wait a full 6 months. We know that once you get your 2 doses of vaccine, you have really good protection. And if you're in one of those populations where we do have some sense your protection might wane, for example, if you are quite in one of the older age groups, what we know is it takes a long time before that waning becomes significant. We know that you can wait 5, 6, 7 months before you actually need that booster dose. And so unlike with doses 1 and 2, where you need to get a dose as soon as you could, you know, run, don't walk, get your 2nd dose. With the booster doses, it's still important to get it when you become eligible, but it's not the same kind of urgency because you still have that really strong 2-dose protection, even 6 months out from your 2nd dose. So while we do want to offer those doses and follow the science on who should get booster doses, it's not the same context as getting dose 1 or dose 2. And so we are telling people get it when you can, but it's different.
Thank you. Helen, what would you say to parents that are still hesitant about getting their young children vaccinated?
Oh, this is a really tough one, right? Because it's hard to understand what the hesitancy is about. And certainly there's a lot of layers to this issue. We have people that are hesitant to get their own vaccine, right? So then they would also be hesitant to get their kids vaccinated. We have parents that don't want to get their child vaccinated because they're worried about their child's reaction to the needle. And the child might have a needle phobia, which again is quite common. I've certainly talked to lots of parents who are concerned about the long-term implications of the COVID vaccine. There's a lot of misinformation out there about fertility issues, for example. And I think some of this misinformation feeds those fears as well, which we see with adults and with parents who are considering vaccines for their kids as well. So when you put it all together, it really is very hard to put your finger on one reason or one issue. We know it's a very complicated issue. But certainly what I would say to parents is that this vaccine for kids would not be approved unless it was safe. And there has been a long history of mRNA vaccines and the safety and studies of those, and certainly Matt and Anne-Marie can speak to that much better than I can. It comes down to just managing your own fears, trusting the science, and knowing that leaving your child unprotected is actually something that you should be more fearful of than actually the vaccine in terms of what COVID can do. We're seeing the spread amongst children much more. And certainly, again, we're not seeing children who are getting really, really ill, but the possibility is always there.
Mm-hmm. And transmitting it when they become ill as well.
Yes.
Thanks, Helen. Anne-Marie, I know that you're busy answering some questions there, so just jumping in with a question for you.
Okay, sounds good.
The person says, I am scheduled for my third booster of the COVID-19 vaccine. I'm 70 plus years old. Friends say that this is selfish, as we should be sending our extra vaccines to other countries. Your thoughts, especially with the work that you've done with, HIV/AIDS in different parts of the world.
So that's a moral and ethical dilemma, which probably could take an hour and a half to discuss.
You have 1 minute.
I have 1 minute. So the first thing that comes to mind is, yes, we should be giving more vaccines to resource poor countries. That's starting to happen. But also, we need to decrease community spread of the virus in this country, or we will contribute to the long-term existence of COVID-19. I've said to people before who've asked me this question, it's the same as sitting in with your child beside you on the airplane, and what they ask you to do is put your oxygen mask on first before you put the mask on your child. So that's one point of view, although I am torn on that issue. I think it's important that we follow public health guidelines in this country and do our best to get as many vaccines to resource poor countries.
Matthew, you have a comment for that?
I think I'll agree. I think it's a challenging dilemma, and it's kind of a scenario we need to do our best at doing both. We know that we want to obviously give everyone in our communities the best protection we can offer them, but we do have a really strong imperative to get people around the world fully immunized. If we think about where we are right now, in many ways, the fact that we're still seeing the kind of transmission that we're seeing is because of the variants of concern. We had the Alpha variant that arose, last winter. We of course know dealing with Delta variants. These variants, they don't pop up out of nowhere. They come from scenarios where people are living and working in really high transmission areas where COVID is spreading in large amounts. The more chance COVID has to spread, the easier it is for variants to develop. And so as long as there are parts of the world, no matter how well protected we are in Canada and Ontario, as long as COVID is spreading unchecked in other parts of the world, there is a risk of new variants emerging. And that risk isn't going to go away until we get people around the world, truly globally, fully immunized. That's really important for our safety here. It's not just about being altruistic. It actually is in our self-interest to get everyone immunized.
Thank you. Helen, do you want to comment on that?
No, I don't think so. I think it's, we're again that's why we call these webinars trying to find the balance, right? We are really trying to find that balance between maximizing our protection here while continuing to look outside, because this is a global pandemic, right? That you can't separate one from the other. We're one world in this whole story this year. So I think Canada, it has the right balance right now, but as things go on, hopefully we'll be able to give more and more to third world countries.
Thank you.
Marva, can I answer 2 questions really quick that are right here?
Yeah.
Is that okay? So there's one question here about side effects that we expect for kids. Kids are doing very well with the vaccine with only mild side effects, fewer side effects in the short term than adults have had, with pain and swelling at the site of the injection, maybe some muscle achiness, low-grade fever, but that's it, and it doesn't last very long. No risk of adverse events. So that's really important. No risk of adverse events, no risk of myocarditis with 3 million kids already vaccinated in the USA. That's great news. And then the other question, which was off of Facebook, is do we know who are getting the majority of breakthrough cases? And I'm going to hand this to Matt in a sec, but people who are not fully, have not developed a full antibody response because of underlying chronic illnesses or because they are vulnerable and older, they can definitely get COVID-19 even though they've been vaccinated. But I'll give you a warning. I spoke to a 20-year-old yesterday who had 2 Pfizer vaccines and was tested positive for COVID, and all he has is a sniffle. He tested positive because he gets work testing done a couple times a week. And so I reassured him that even though he's a breakthrough case, he is far less ill than he probably would have been without being vaccinated.
Okay, that's good to know. And what if Matthew's going to comment on that? I have a question for him as well. Someone asked, why as a healthcare worker, I can only get my booster shot at my doctor's or pharmacy? Why not at the health unit? In addition to anything you want to add to what Anne-Marie just said. And I just want to tell everyone, this is going to be like a firing round, like really quick. Yeah. When we get back after this question is answered, we're going to try to get as many questions as possible within the next 20 minutes.
Thanks, Marva. I'll speak to that last question. So we are going to be offering ways for healthcare providers to get immunized through clinics that we run in the coming weeks. But we do know that we have healthcare partners, hospitals, for example, who are stepping up and offering vaccine doses through clinics that they run to their staff. That's not going to meet the needs of every healthcare provider in our community, but it is going to meet the needs of a lot of them. And so we really want to work with those strong partnerships we have to get as many doses into arms as possible, as quickly as possible when they're recommended. So that's why we're working with partners to get those doses into arms right now.
Great. That's super. There's some duplicate questions here that I just went through. So that works out well for us to get through some questions. In the previous webinar, it was stated that there would be a 4th wave due to the high percentage of people vaccinated, and that the term 4th wave would only be a term the media would be using. Do you still believe that this isn't a true 4th wave?
I can answer first, Matt.
Yeah,
sure. Go ahead, Anne-Marie.
The 4th wave. There's something that that I post quite regularly, a graph that I post quite regularly that shows the 7-day rolling average and how it went up in the first wave. In the second wave, it went up again. In the third wave, it went up even higher. And now there's definitely a 4th wave, but it's not getting to the high numbers that the 3rd wave went to. And we're kind of hanging steady. And if you subtract the kids that are getting COVID, we're hovering between 400 and 500, which is a really nice steady state. And that's the result of vaccination. So it is a wave, but it's not taking off just yet. Thank goodness. It is in other countries, though. It is taking off in Europe and in other countries that are not as fully vaccinated as Canadians are. Unless you get to 80, 85 or more % double vaccinated, this Delta variant is sneaky and it will create a massive wave. So congratulations to Canadians. And please, if you haven't been vaccinated just yet, get vaccinated and add to that number so that we're all protected.
One thing I'll just add to what Anne-Marie said is that if we think about how we understand, are we in a wave or not, oftentimes we'll look at the provincial numbers and the graphs they have on the provincial website. We'll look at WDG's numbers on our website, and you'll look for the overall kind of pattern of a line graph that we have. And that is great, but it only tells part of the story. One of the things that we've seen is that this fall has in some ways been a tale of two pandemics. We have seen that for people who are in pockets of our community that are not well immunized, where immunization coverage rates are low, or where they're in populations that aren't immunized for particular reasons, case rates have been higher this fall. We saw a larger fraction of cases in children this fall because they couldn't be immunized. So we did see a significant bump in transmission. And for people who were immunized, they didn't experience the fourth wave that way. They had much lower risk of transmission. Their experience was much safer this fall, and they had fewer cases in those overall numbers. So, we had a fourth wave, but it wasn't a fourth wave that impacted everyone in the way that previous waves did. This really was a scenario where people who were vaccinated faced relatively low risk, but people who were unvaccinated faced much higher risk. And we knew that as the colder weather hit, people were spending more time indoors. There was always the risk of transmission would increase among those who were unvaccinated especially. And so we have seen this divergence, and it's something that really concerns us. And it speaks to the importance of getting vaccinated and the impact the vaccines can have if you get one.
Thank you. The firing round now. The vaccine has proven not to stop infection nor transmission. So how do the benefits outweigh the risks of vaccination?
I'll happily take that one. And I'm not sure, Anne-Marie, if you'll have things to add, but of course, this is always about the risks and benefits. And the idea is the vaccine offers you really good protection because it helps train your immune system to recognize the virus if you ever encounter the real thing in real life. But no layer of protection is perfect. We know the vaccines, even if they're 95% effective, that means there's a 5% chance that it's not going to be perfectly great for you. And there's always a chance that you could get COVID even if you are vaccinated. That's why, for example, it is still important to wear masks, to symptom screen, things like that are still important even if you are vaccinated, because while they are highly effective, they are not perfect. Nothing is foolproof, even though it's a very strong layer. It's not a perfect suit of armor, but it's like wearing a shield and elbow pads and knee pads, even if it isn't covering all of you. So it's really good protection, even though it's not perfect. The other thing to consider is the question about benefits and risks. And of course, I can talk about how effective these vaccines are. Even if they are not perfect, they are still very strong, very effective. 95% is an incredible number when you consider that in a good flu season year, you may have a 70% effective vaccine. So it's an incredibly strong number that we're seeing from these vaccines, and those numbers are being borne out in real life. When you weigh those on the one hand against the risks of the vaccine, what are we talking about when it comes to risks? We're talking about, the really rare risk of an allergic reaction. We're talking about the risks of things like myocarditis and pericarditis, which fortunately are rare and fortunately are typically mild. Of course, we really want to have high safety standards and monitor for any reasons to be concerned. But what we're seeing is that these vaccines are incredibly, incredibly safe. And of course, the risk of having any of these, purported vaccine complications, compare that to the risk of the same complication with a COVID infection, and it's night and day. So if you think about these incredibly strong and effective vaccines, where we have confidence they're effective against, what we're seeing with these incredibly safe vaccine products, the risks and benefits are really clearly weighing in one direction.
Thank you. Helen, how do you gather without worrying about asymptomatic carriers?
Great question. It's invisible, right? So COVID, we know COVID and Delta are invisible. It'd be awesome if we could just see them, little spray something in the air and there it is, but that's not how it works. So I think we need to do what reasonable people do, and that is follow the public health guidelines, get the most amount of protection you can get, which is vaccination. Continue to keep your numbers small when you're interacting, keep the air flowing and circulating, do all the things that we know based on science are actually protecting ourselves and minimizing the risk of exposure. Beyond that, it really is about letting go of things that we can't control and letting go of things that may happen, even though we're doing all the right things. And that's what has been so frustrating in this pandemic is we can do all the right things and still contract COVID. So we have to let some of that go because we still need to be able to experience the joy. We still need to be able to experience gathering together and feeling that connection with people and having the conversations and being present because that is what keeps us well and keeps us grounded. I often like to think of the vaccine, and Matt explained it this way as well, like it's wearing a bulletproof vest, right? It doesn't mean that you can't get shot at. Still, you can still get shot at, but that bulletproof vest will prevent you really from dying because you won't get shot in the places where you're going to die. So that's what the vaccine does. It protects you. It's that bulletproof vest. It's not 100%. There's still risk out there, but it still does help you keep safe. So still be able to enjoy and be present and take meaning in those connections, even with all the things that we can't control.
Thank you. And we recognizing there are risks to air travel. For those of us who will be doing it over the holidays, what are the best ways to reduce risks, especially for children when you're traveling?
Yeah, it's really unfortunate. It's not unfortunate. It's great that we have vaccines for children, but we won't have double vaccinated children by Christmas time. If adults are traveling and they're double vaccinated and they wear a mask and follow protocols for masking and testing, depending on where you're going and where you're coming from, you should be safe. And you need to keep your kids close and keep them masked if they have not yet been vaccinated. So would I travel if I had kids under 11? That's the better question. Yes, I would. So if I were planning a trip over the Christmas holidays and I was going to the Caribbean, for example, which I'm not doing, I would keep my kids close, put a good mask on them, and keep them safe at whatever resort I was in, make sure they weren't mixing and mingling with folks that may not be vaccinated, although I would not go to a resort unless I knew they had a really tight vaccination policy and everyone eligible on the resort was vaccinated.
Thank you. Matt, will public health be contacting people who need boosters?
Public health has already begun contacting people in the over 70 group who are due for their boosters. We've been reaching out for a few weeks and have begun to offer those booster doses. We'll still be doing that reach out along with other partners who are offering those booster doses. And if in the future, the eligibility expands for booster doses, we'll still work with partners to make sure people can access them in our community.
Thank you. Is there benefit to spacing the vaccines over 8 weeks? Someone said that I thought kids only had to wait 3 weeks between first and second doses.
I think that's it. Yeah, sorry, Matt, that's the difference between Health Canada recommendations, and they base their recommendations on Pfizer's research, the research that is presented to Health Canada by the pharmaceutical company. But NACI is able to look at a lot more research other than just the primary research trials from the pharmaceutical company. And that research is suggesting a much more robust immune response if we wait 8 weeks.
Okay.
And we covered it perfectly.
Yep.
Say what the acronym is for NACI again, Anne-Marie, for those who don't know, who are listening.
National Advisory Committee on Immunizations.
Okay, thank you. A question from Facebook. Why have vaccines not been mandated in our area for youth 12 and over that are participating in indoor sports? Spectators are required to be, but not those who are participating.
So that's a really good question. We know that, of course, the pandemic has been really difficult for, youth who are in that 12 to 17 age group. When the province laid out its approach to mandatory vaccination, they required, for example, proof of vaccination for spectators age 12 and up, but they did carve out an exception for people age 12 to 17 who are the active participants to try and create a safe way for people to participate in that age group, kind of recognizing the impacts of the pandemic on them overall. That's the rationale. Obviously, you want everyone to get vaccinated across all age groups if they're eligible. And we're fortunate that as we get more and more people immunized, the overall risk goes down. But that is the way things currently stand right now.
Great, thank you. There are two related questions. One, a person was speaking about having under a 4-year-old in daycare, and because of colds, the child is being tested all the time. Children are being tested because they're coughing and sneezing, but none of them have had COVID. And this person is talking about the long-term effects of a child being tested over and over. Related to that, this person is talking about Christmas gathering. Our immediate family is double vax. One will have had their booster. One 8-year-old will have one vaccination, and one 3-year-old obviously is not vaccinated. To ensure everyone's safety to gather at Christmas, might rapid antigen tests be utilized to ensure that they are healthy? Total gathering would be 6 adults and 2 children. This person is very serious. Who would like
So
that one?
where would you like me to begin with that, Marva? Which piece of that would you like me to answer?
I would say maybe the second, and then we'll go to the first about the continuous testing for children who have colds.
Sure. So the first thing I'll say is if you're gathering this Christmas, and that gathering includes people who are becoming eligible in that 5 to 11 group, and people who are ineligible in the under 5 group, the most important thing to do is everyone who can be 2-dose immunized, get their 2 doses. Everyone who's in that 5 to 11 group, get them their first dose at least. And then those factors will reduce the risk for people who are not completely immunized there. Vaccination is still our biggest and most important tool to reduce risk. As I said, it's not perfect, but it is our most important tool. And if everyone who's there can be as fully immunized as possible, that will benefit and reduce the risk overall at that gathering. Obviously, depending on the size of the gathering, you want to think about how to engineer that gathering, keep it small. If you're having mixing of households, you want to consider whether masks are appropriate, etc. And the question asked also about rapid testing. Rapid tests are one of the other tools in our tool belt. So if you take one, it can help give you some indication about whether or not you have COVID. It's not as good as the PCR testing that people will get, for example, at an assessment center. It's not quite as sensitive a test, but it still has some value. The key thing is if you're going to use rapid tests, to use them properly, which means that you have to do multiple tests over multiple periods of time. And one rapid test, for example, to rule out symptoms that you have as a cause of as evidence of COVID, that's not going to be good. You really need the full PCR test in that scenario. Rapid testing is challenging because it's not used in all the same ways we can use other PCR testing, but it is one of the tools we can use on top of the other things, with vaccines being the most important.
Okay, so for this family gathering, is it a suggestion that they do rapid tests for the 8-year-old who would not have been vaccinated yet, or even the 3-year-old? They're quite concerned about that.
So it's something they could consider doing. Certainly, as they say, it's one piece of a bigger puzzle. What we want to avoid is people relying on rapid tests as the only measure or as the definitive proof someone is or isn't infected, because it's not a perfect kind of test.
Thank you. Julie thanks you, Helen, for the advice for children's appointments, and says one of mine is very anxious. One of the questions, another question from someone was about that public health had accommodation for people with needle phobia. And Helen, you were talking about phobias.
Yeah.
Is there that accommodation for children now that have needle phobia? Is there a special way of dealing with that when they're getting their shot, their vaccine?
The short answer to that is yes. So of course, I mentioned earlier, there's different ways to access vaccines. Sorry, Helen, did you want to
No,
speak?
you go right ahead, because that's exactly what I was going to say.
Yeah, I was just
Over
going to
to
say, sorry. So we know this is a really key issue. It's a key barrier to immunization. It's a key concern for parents and families.
Yeah.
We want to make it as easy as possible to get the vaccine. We want to make the experience of getting the vaccine as positive as possible, because we know people who are getting dose 1, they still have to get dose 2 down the road. We want them to come back for that dose 2 to get fully immunized. So, we have processes that we're developing for our clinics to make sure that people can get immunized appropriately if they have needle phobias. We're working with partners who are immunizing about that exact issue, because we know this is a big concern people have.
Now, thank you for that. I have a couple of questions here, and I'm not sure whether to ask them, but I think I will, because there are folks that are sharing information, and some that are on target and some that are not. So I'll just throw this out to you. Can you please confirm exactly how many children aged 5 to 11 have died due to COVID-19 since the pandemic began? I'm not sure if we'd have, whether this is across the world, across North America, across Canada, in Guelph. I'm not sure what the catchment is that this person is speaking of. And then 2, they said, of those children who died, how many had comorbidities and how many were healthy? Do we have any of those stats at all?
I'll answer part of that question. 650 in the United States, children under 11 have died of COVID-19, which is a very small number when you think of the number of people in the USA, but no death in a child is acceptable. I don't think we have the ability to publicize information about a person's health conditions because that information is private. So a lot of folks are frustrated because they don't have access to that information. Are the new cases today, for example, mostly in immunocompromised or in the elderly and so on? I think we can give some of that information, but we have to be very cautious about a person's confidentiality.
Okay, thank you. Anyone else wanted to comment on that? That's fine. Go ahead, Matthew.
I'll just say, we know that when it comes to COVID-19, age matters. You know, if you are an 80-year-old or 90-year-old, your risk of dying of COVID is higher than if you are a 5-year-old. That is true. The data shows that. However, your risk is not 0, even if you're a young person. And what's really important is that the risk of dying from the vaccine is still incredibly like, there's negligible risk there. So if you're talking about the risk benefit calculations and understanding whether it's the right or wrong decision to get the vaccine, even if there's some risk of dying of COVID or going to hospital with COVID as a young person in that 5 to 11 age group, it's still more important to get vaccinated because you can cut that risk down dramatically while not taking on significant new risk by getting the vaccine. It's an incredibly safe product to get, and it does reduce any risk you have of going to hospital or dying with COVID.
Okay, thank you. And what if you don't have a family doctor and your child has a mental health disability and is afraid of public, as well as phobia of needles? Is there a place more private for that child? That ties into the question that we had asked before about needle phobia with children. In this case, a child with special needs.
So just speaking in our clinic, so people will be able to get vaccinated in our clinics. If, for example, you know, they live in certain communities and if they can't access a vaccine through their family doctor. In our clinics, we are thinking about how to make sure we have a good experience for people with needle phobias. We want to make sure people are getting immunized in a way that's comfortable for them. And so there will be that availability in our community.
Just as a follow-up question to that, I know I've had lots of people ask me about the Stoneworld Mall Clinic in Guelph, and just, you know, people are going to be, can you just give a sense of what that's going to be? People aren't going to be sitting in the middle of the mall kind of getting those shots, are they? If you could just maybe reassure people a little bit about their privacy within a mall setting.
That's a really good point, Helen. I know this time of year, people might be thinking about sort of the Santa Claus sitting in the middle of the open mall area. And we're not going to be getting the vaccines in the middle of that sort of that mall court in the same way that you visit Santa in a typical year. This is going to be, you know, we have a clinic inside the space of Stoneworld Mall, but it's a clinic. So you have privacy, you're immunized in a safe space, in a private space, in a comfortable space. It's not going to be a public event to get immunized. It is a bit more private so that people feel comfortable getting the vaccine.
Thanks.
And we're picturing the person sitting in that one of those comfy chairs that they have in the middle of the mall there with the, I've seen people doing eyebrows right in the center of the mall, which is quite interesting. These two questions are related. It might be our second last question. My gym allows 24 people, masks optional on a daily basis. Help me make sense of why this is okay. And a one-time gathering of 25 vaccinated people at Christmas is risky. Is it the length of time spent together? That's one. I'm going to follow up with the next question. It is safe to attend hockey games or similar events. It's a question. Is it safe? I know they are open and everyone needs to be fully vaccinated to attend, but listening to you be concerned about 25 gathering, it's making me nervous about attending indoor events that have much larger numbers. Wants to
So I
take.
think I can kind of go back a step and talk about kind of how do we make sure we have safe gatherings in general. You know, people are gathering in homes and social settings, or gathering in places like gyms, gathering in places like restaurants. There's all these different contexts in which people interact. And our goal in public health is to think about all those different settings and reducing risk across all of them. So when it comes to places like gyms, for example, if they have a mandatory vaccine policy, people can only get in if they've gotten 2 doses and they have proof of 2 doses plus 2 weeks, like that reduces the risk dramatically. And that's why, for example, people can gather in certain kinds of numbers in settings like gyms or restaurants or other facilities. We know that when it comes to social gatherings, there are also similar ways to reduce risk. You can keep the numbers small. You can make sure everyone who's gathering is fully vaccinated. All those things we spoke about earlier, you know, those same principles still apply. We know sometimes the rules and regulations across different settings that the province sets aren't always completely, you know, aligned one-to-one because they change piecemeal. But the key thing is, whatever setting you're gathering in, think about how to reduce the risk there as best you can. Oftentimes, those social gatherings, like our homes, are the settings we have control over, where we can set the rules. We determine who we invite over. We determine how we're going to organize that gathering, whether we're going to make sure people are feeling well before they come here, whether we're going to make sure people are vaccinated, etc. They're the domains in which we have the fullest control. And what we're asking is for people, as they're planning their holiday gatherings, to think about those levers they have and to gather conscious of the rules, conscious of best practices to keep themselves and each other safe.
Okay, I'm going to leave it with that because I'd love to get some closing remarks from each of you. It is right at 8:15, so maybe just 30 seconds. The questions, to let folks know, the questions that have not been answered, we'll attempt to answer those questions for you, so you can go to Anne-Marie's Facebook or on CMHA's website, and we'll work on answering those questions for you to the best of our ability. So I'm going to go backwards from from when we had the opening remarks, and I think starting with you, Matthew.
Thanks, Marva. I'll just
Thanks for being here. Yes.
Well, thanks for having me, and just thanks for everyone who came out, asked questions, who engaged and brought forward the things they're thinking about. We know that it's been a really challenging 2 years in this time coming up as we enter the colder months. It is a time people are worried, they have questions, they want to know about how to gather, how to have vaccines. And I really appreciate the chance to address some of those questions, but I know that not all those questions are going to be addressed in this hour that we have together. We have a lot more information on our website at wdgpublichealth.ca, and we're going to continue to give updates as circumstances in the community could change. So please keep up to date with the latest information, and other questions that may not have gotten answered here are probably answered on our website. So please do look there, because we know you're wondering things. We want to make sure you have the best information.
Thank you for that. And I think Helen, I don't remember if Helen went first.
Yeah, I would just echo Matt's comments that definitely this year, I think, has been the hardest thing we've ever had to live through. The lockdowns, the fear, the anxiety, the unknowns, the losses, and we've really stepped up as a community to be part of the solution. We've embraced the vaccine despite, the worries that people have and the fears that they have. There's certainly the fear of COVID, and the science behind that is driving us to step up even further and now vaccinate our children. So I think we have a lot to be proud of and a lot to be grateful for. And we need to, of course, keep going in this fight against COVID. And I would say one thing just to remember over the holiday season, again, as we adjust to a different holiday this year, even though we can certainly embrace many of the rituals and getting together in small numbers. But I would just remind people that it's not happy people who are grateful, but grateful people who are happy. So just to remember to bring that gratitude and to really embrace that because that perspective is so important.
Thank you so much. Thank you, Helen. Anne-Marie?
On that note, Helen, I'll just say I'm very grateful that Matt was with us tonight.
Yes.
It would be very hard to field all these really important questions without him. There were 99 plus questions. And I know I did not answer 99. So I think there are still questions that people are asking. It may be a good idea for us to have another seminar before Christmas, just to, and we'll talk about that, just to reiterate how to be safe when you gather at Christmas time. We still need to be so safe this Christmas. Vaccines have protected us to a great degree, but gathering inside with large numbers, and even gathering inside with small numbers, if that space is small and not well ventilated, it is not safe. And I'm going to write a post about vaccine ingredients. I've done that before, but it was a while back, and lots of questions were around what ingredients are in these vaccines, and how much of a risk is there to have an allergy to a vaccine ingredient. So I will post about that.
Thank you so much. Matthew, again, I echo everyone's thanks for being here. It was really great. You're a wonderful addition to the group. And of course, Anne-Marie and Helen, as always, thank you. And thank you to wonderful individuals who sent their questions in, and those who were just listening. We do appreciate being able to have this conversation with you. And we thank you for tuning in and listening to this. We love being able to support where we can our community. I'm not sure whether Tracey was going to come back on. Tracey, were you going to come back on? Here you are.
Yeah.
And Tracey,
Sure. Yes. I just actually, just as a person watching this amazing webinar, Marva, I know navigating those questions is difficult, and Anne-Marie, they're really hard, and you're looking through them and you want to answer all of them in this time frame, and you can't. So thank you for trying your best to answer all of those. And this is very important, this time together. And an hour is not enough. And I think we could be on here for a week and it wouldn't be enough. But I do think that we should do another one before Christmas, because it does seem like the need is really there. This is a scary time for our children. I think during this time, one thing I've been grateful for is that my kids are 20 and 22. And I really feel for people that have young children, and I really feel for you. So I just want to just chat very quickly about Bracelet of Hope and give you a little bit of update there. And thank you. We have had many donations during this time, and it's really critical. So Bracelet of Hope is run by the board of directors and volunteers. So there are no paid employees, and we do not have an office. And what that means is that the majority, 99% of all the money goes to programming in Lesotho. We have a mobile health unit that started as treating HIV, AIDS people. That's initially what it was for. And now we're also testing for COVID and education around COVID and maternal health, and for children under 5. So it's incredible. We actually, in 2020, we launched the mobile health unit in March of 2020, and we saw almost 9,000 people. It was 8,917 people in 2020. And from January to the end of June, we saw almost 6,000 people. These are people that live in remote areas. And now we're actually carrying the Johnson & Johnson COVID vaccine. So we're vaccinating people in these rural areas that have no access to healthcare. So it really was beautiful, immaculate timing, and it's incredible. So I want to share that. If you are able to donate, you can go to our website, www.braceletofhope.com or CA, forget. CA, thank you, Anne-Marie. Please go to the website and you can donate online, and it is a charitable organization, so you'll get a tax receipt. So I just wanted to give that a little plug there, because we're doing incredible things and getting healthcare to these people that are so beautiful in Lesotho that don't have access. So Marva, thank you for navigating this beautiful conversation and this difficult conversation. Thank you to the team at CMHA. So that's Helen and Megan and Allison. You truly are all just amazing. It's a lot of work to pull this together. And thank you so much for that. And Helen, you haven't skipped a beat. You've been on every single session. This is volunteer people. These people join us in their evenings after they've worked all day. So every one of you, thank you so much. And Dr. Matthew, thank you for joining us with we were hoping to hear your baby girl in the next room, but we didn't get to hear that. But thank you so much for taking the time away from your family in such difficult, stressful times for the medical profession. And Anne-Marie, thank you. Keep on. I know it's so hard at night to post on Facebook because it's hard for anybody, but we are all needing it. It's so valuable, Anne-Marie. So thank you for doing that. I know everyone thanks you. And I know it's hard. I know it's so difficult, but we're so, so grateful. And keep going. We're here with you. And just thank you all for joining in tonight. Hope that you got some tidbits and a little bit more information. And we'll see you next time. Thank you so much.
And
Take
thank you
care, everybody.
for our healthcare workers.
Yes.
Public health, thank you so much for
Doing an amazing job.
Yeah, just keep it going, please.
Yeah, keep strong. We'll get through it.